My name is Dr. Adrienne Hicks, and I am from Greenwood, Mississippi. It's near a small college called Mississippi Valley State University, where I was born and raised. I graduated Xavier in 2007, and I am currently an attending psychiatrist at the VA hospital as well as Yale University. So I transfer into Xavier so I could get a better clinical experience, also be able to choose exactly where I was kind of going. With other universities, they basically saying, you're going to go here, you're going to go here. So that gave me the opportunity to choose to go to Atlanta, Georgia, where, which is actually closer to my home in Mississippi. I had a great experience. Had some really great rotations at Atlanta Medical Center, at Emory University, which opened so many doors for me. After graduating from Xavier, I actually started a couple businesses initially. Actually, I started my own USMLE review program called USMLE Master System, and then I started a nonprofit organization called the ALH Foundation after my mother, Anna Louise Hicks, who died from cancer. And then I went on to do residency in New York City at Harlem Hospital, which is a part of Columbia University School of Medicine. And then after that, I went on to do a fellowship in addiction psychiatry at Yale University, where I currently am. I have a few different roles. So at the VA, I'm an attending psychiatrist in the PTSD firm, where I am the medical director of the PTSD Rehab Recovery Program. So it's an inpatient program where patients can come for rehab for like 2 months at a time to help them cope with whatever traumas they may have had in their particular lives. And I'm also an attending at the NIPSI firm. It's like a neuropsychiatry firm. I also work in the medical ED at the VA, and I also do ECT treatments, which are electroconvulsive treatments for patients who have resistant illnesses such as depression, bipolar disorders, and also do RTMS treatment, which is another type of shock therapy for patients who have, resistant illnesses. With Xavier, it really gave me the opportunity to explore opportunities for the future. I mean, we all know that, there are things like family medicine, internal medicine, psychiatry, but at the same time, there's so many other avenues that we can go into, especially like it gave me the opportunity to kind of learn things through electives, and there were other things like getting into residency, those particular classes that kind of tell you what you need to kind of focus on to make your, your resume look good, what other things you can do to make yourself, presentable to the community, things you can do for, people in our community too, to, just to help everybody in general. So, but all those, clues or those keys came from Xavier. I think it's an excellent opportunity for the students in general to see, people who have graduated and what they're doing, and who can also give back the information so they can make their transition easier too. Because it's sort of like B1, C1, do it yourself. So like right then, I was talking to some students saying like, I really am interested in psychiatry. I'm not sure exactly what all steps I may need to do. So hopefully my words, my guidance will help them have an easier transition as well.